All right, so let's discuss about feedback statements. So when you get the result, they will be giving us the result in these feedback statements. We have got 10 feedback statements: consultation, rapport, management, listening, language, time, diagnosis, examination, finding, and issues. So these are the 10 feedback statements, and accordingly they will be dividing our result. So if you are getting less marks, so total marks 12. If you're getting less mark, where we are lacking, maybe we are lacking consultation, maybe rapport, issues, management, finding, examination, time was not appropriate, maybe we were not able to come to the diagnosis, our language was not fine, or we were not able to listen to them properly, or we didn't get what they were saying. Right, so that's the feedback statements. Let's discuss these feedback statements one by one. Consultation, what they're expecting and what they don't want us to do. They want a smooth consultation, and they don't want a unstructured consultation. They don't want a consultation which is going illogically and going in disordered approach. Right, so smooth consultation, anytime if you're taking history, there is a pattern of taking history. So always first we take present history, right? Then we have history of presenting complaint, we elaborate things. We have got past medical history, then we have got personal history, we have got social history, and then after that we move on to examination, investigation, management. The thing is, we do have a pattern. It's not like you can jump from this pattern. If you jump from this pattern, there are high chances you will get a tick in the consultation. So that's the chance you may get a tick in the consultation. So be very careful and make sure you're going in sequence. First present history and elaborate that present history. Sometimes what happens when you're taking present history, suddenly you will jump to personal history. You just ask one question and again you remember, oh, I forgot one question from present history. You'll go back to the present history, then coming back to past medical, going again to the personal history, then coming to personal, going back to present history. So when you're jumping from one part to other one, there are high chances they'll give us a tick in the consultation. So make sure when you're doing the consultation, you're following the order and making it a smooth consultation, right? So this is the main thing, the consultation. It should be smooth, right? Issues. Every time you will see there will be some issues. That's why patient is in the hospital, isn't it? So we need to recognize that issues and we need to treat them accordingly, right? And you might be thinking, should we do the medical management first or should we do non-medical management first? See, it depends on you. You are the doctor and you have to see what my patient is having, what's the problem. For example, like if you're giving a health and lifestyle advices to an acutely ill patient, do you think that makes sense? No, that doesn't make any sense, because this patient is acutely ill, maybe needs oxygen, and you're telling don't smoke, don't drink alcohol or do good exercise. No, that doesn't make sense. He's dying in front of you, he's having wheeze, he's having shortness of breath. You need to treat him actively. So nobody is going to tell you whether you'll do non-medical management first or medical management first. It's you who will decide. If you feel patient is ill, acutely ill, go for medical management. And if you feel it's a simple counseling station, maybe diabetes counseling or maybe high blood pressure counseling, maybe stroke counseling or whatever it is, then you can go for non-medical management first and then you can tell them the possibility of the medications as well. So that is how it works, right? So recognize the issue properly. Time. See, time management is very, very, very important actually. So it should not be a poor time management. If you are having poor time management, you will miss something. And if you're taking too long over one element at the expense of the other important area, because we know we have got three things. We have got data gathering, we have got interpersonal skills, and the most important we have got as management. So if you're taking if you're taking too much time for data gathering and you may not be having enough time for management, you just left say 1 minute for the management, do you think they are going to give us 4 marks in the management? Never. They will never be giving us 4 marks in the management because we haven't spent the time in the management, right? And in the exam, you're not allowed to carry your watch and there won't be any clock in the exam hall as well, in the exam cubicle. So how will you be getting to know how the things work? So what happened in the exam, there will be a bell. So as you know, it takes 1.5 minutes to read the task. So after 1.5 minutes, when you have read the task, so what happened, there will be a bell saying begin. So you will begin the exam, you will go inside, and inside, you know, you have got 8 minutes. You have got 8 minutes, but it will be divided into 6 minutes and 2 minutes. 6 minutes and 2 minutes. So there will be a bell after 6 minutes. There will be a bell after 6 minutes, which will say 2 minutes left, which will say 2 minutes left. So it's just a hint for you. So you won't be having any watch, no clock. That's the only hint that you have got is this bell. So after 6 minutes, it will say 2 minutes left. And after that, you'll be having 2 minutes. Once you are done with the whole 8 minutes, it will say move on to the next station. So you have to go to the next station. Even if you haven't finished, they will kick you out. They will tell you that, doctor, you are done, please go, because the next station, it has already started. You have to read that, and you will be having only 1.5 minutes. So as soon as possible, the bell rang, make sure you close the station, thank you, and you go out and start your next station. So management is very important, and make sure you give enough time to your management. You give enough time to your management, because if you're spending too much time on data gathering, so you might struggle to do the management later on. So make sure you're spending in a simple history taking station 4 to 5 minutes roughly for data gathering, and 3 to 4 minutes for your management. Regarding interpersonal skills, so the thing is, you don't have to spend any time on interpersonal skills, because interpersonal skills is something like you're showing it in the exam, right? Because you're talking to them, and that's it. I mean, how you're talking, are you empathetic, are you giving them importance, are you listening to them properly, if you are interrupting them or not. That is how it works. Interpersonal skills, that will be calculated under these criteria, but make sure you are spending enough time on data gathering and enough time in the management. So if there is any poor time management, they might give you a tick in the time column, and if you're taking too long in one of the domains, they might give you a tick in the time management, because your time was not appropriately managed, right? So we have got findings. So we need to identify the abnormal findings or results. So if you are not able to identify or recognize significant findings in the history, in the examination, or in the data interpretation, so they might give us a tick in the finding. So for example, like in history, they will be giving us lots of finding. In history, they'll be giving a finding of, say, chest pain, giving us a finding of fever, maybe some accidental history, maybe travel history. So that's a positive finding. You need to find it. And if you are unable to find, they might give you a tick in the finding. While doing examination also, you might get some findings. You're doing some examination, and they will be giving you finding. For example, you're doing diabetic foot, and they will give you loss of sensation, maybe below the ankle, below the mid shin, or below the knee. So that's your finding. You should be able to find it, and you should be able to interpret it. What does it mean? And there will be some data interpretation, meaning in some of the station, you might get some of the things like, say, X-ray, or ECG, or some blood reports as well. So when you have got these things, what you're supposed to do when you have got these things, you should be able to interpret it. If ECG has got some finding, maybe ST elevation depression, you should know it is MI. An X-ray, they have given you a mass, for example, so you should be able to know what does it mean, what's the meaning of this mass. Blood reports, so for example, they have given you LFT, like liver function test or kidney function test, urea, creatinine value, diabetic, like HbA1c value, any value. So you should be able to interpret if it is high or if it is low, what does it mean? If AST, ALT, liver function test is high, if bilirubin is high, if urea is high, if creatinine is high, what does it mean? You should be able to interpret it. You should be able to tell it to the patient. If sodium is low, hyponatremia is there, what does it mean? You should be able to find it out. Right? Then we have got examinations. So we need to do proper examination, and we need to use instrument proficiently. So you'll be given some instruments as well in some of the station. For example, you're doing diabetic foot, so you may be getting like tuning fork, like hammer, like cotton wisp, isn't it? So you'll be having lots of instrument. In some of the station, you'll be getting otoscopy, fundoscopy, right? And you may be having antenatal examination, where you'll be checking fetal heart rate. So lots of things you'll be having. So they will be checking if you're able to use the instrument proficiently or not. And you might get a tick in the examination if you are not undertaking physical examination completely, or you are not able to use the instrument proficiently. If you're not able to do this, you may be getting a tick in the examination column, right? So this is the examination. Diagnosis. So if you're not able to make the diagnosis or differential, you may get a tick in the diagnosis as well. See, diagnosis, always try to make the diagnosis, if not give the differential, because only on the basis of history doesn't mean you'll be able to make the diagnosis. In our clinics as well, when we take the history, we get some idea, we get some differentials, and accordingly we investigate the patient and get the finding and get the diagnosis. So in the exam, after doing history, even after doing examination, investigation, if you're not sure what's going on, so just give your differential, like there are lots of things going on in your mind, we need to investigate you properly, or I have to involve my senior, and then we'll see what exactly is going on with you. And meanwhile, make sure you give symptomatic treatment for sure to the patient. That is how it works. And if you're not able to make the correct diagnosis, or if you're not able to identify the differential, then you may get a tick in the diagnosis column. Right. So how you differentiate, how you rule out the differential? By asking question. If you're doing say chest pain, if you've got few things in your mind, like you think it's MI, but you need to rule out some emergency differential as well, like say you need to rule out embolism as well. So ask any surgery or any travel history, any pain in the calf, ask questions. So while you're asking question, meaning you are ruling out differential. Right, so make diagnosis, or if not, then at least go for good differential, so you will not be getting a tick in the diagnosis column, because if your diagnosis is not right, your management will also suffer. Right, so you have to be very, very careful. Management, we have got a column of management as well. What does it mean? Management is proper management plan we have to make. We have to make a proper management plan. Proper management plan includes follow-up and warning sign. These two things are very, very important. Everything has been taken from the GMC website. It's authentic. Proper management plan includes follow-up. Always whenever you do the things, you follow up the patient and you tell them the warning sign. For example, patient came to you with the chest pain and it comes out to be pericarditis. And after keeping the patient in observation for some time, now we are sending the patient home. So make sure you give proper warning sign, maybe giving proper warning sign for heart attack. Like if you got this chest pain which is going to your left arm and to your left jaw, make sure you come back to the hospital, or just call the ambulance. So that's warning sign and follow up. Very, very important. If you're not able to develop a management plan reflecting current best practice, including follow-up and safety netting, you may get a tick in the management column. So make sure you're making a proper management plan for the patient, and which should be according to the current best guidelines, and actually symptomatic treatment, and make sure follow-up and warning sign must. Right? So that's how it works. We have got Rapport as well. Rapport. You need to see like if you're making your patient comfortable or not. If you are making your patient comfortable or not, that is your rapport. How you'll make your patient comfortable: listen to them properly, be empathetic. That is very, very important. Listen, be empathy, and if they're talking too much, maybe nod your head. That's very important, right? And active listening, you have to do active listening. Make sure all the time you are giving enough or proper importance to your patient. So that is rapport, which is very, very, very important. If you're not able to develop a rapport, show sensitivity for the patient feeling and concern, you may get a tick. If you're using stock phrases is like some learned phrases. Patient has said something and you, I'm sorry, I'm sorry, I'm sorry. See, when you're saying sorry, make sure you feel it. Oh, I'm really sorry to hear that. It's not about like, okay, I'm sorry. See, what the thing is, you need to understand is you have to be very polite. You have to be empathetic. And what you're doing, it has to be like feel. You have to feel it. Maybe, you can practice with the mirror. That is going to help. If you practice with the mirror, that will be really, really helpful. Show some empathy to yourself first. And if you're able to do that well, and I'm sure you'll be able to show it in the exam to your patients as well, right? If you're not able to demonstrate sufficiently the ability to conduct a patient-centered approach, it's patient-centered approach, patient-centered approach. So let's see like what patient wants, what's the patient problem, what patient wants. So the consultation should be patient-centered consultation. So if you're doing this properly, you won't be getting a tick. If you're making a patient comfortable, you won't be getting a tick. Otherwise, they might give you a tick in the rapport column. Very, very important. Listening is very important. You need to pick verbal and non-verbal cues. You need to pick verbal and non-verbal cues. See, verbal, they are telling you verbally, doctor, I'm in pain. Doctor, I can't breathe properly. Doctor, I've got headache, doctor, I've got tummy pain, doctor, I've got pain in my joints, doctor, I can't sleep. Verbal communication. They might give you some non-verbal communication things as well. They might give you some non-verbal cues as well. You're talking to them, they're not giving you eye contact. They're just looking down. They're not giving you eye contact. They're looking here and there. There might be some other things as well. I mean, they were sitting, but they are giving some stress on their leg. I mean, every time they're just looking at the leg and showing you that I'm in pain maybe, or they may be shaking their leg too much. So that is a finding for you. For example, thyroid. Just an hypothetical example, like if you got a station of hyperthyroid, the lady, because it's most common in females, might be shaking the leg too much. What she's showing anxiety. You need to pick that up. That's a non-verbal cue. I can see you are shaking your leg. Is everything all right? Is there anything is there anything I can do for you to make you more comfortable? That's your non-verbal cue. You need to acknowledge that, right? So if you have got poor active listening skills, they might give a tick in the listening. And if you didn't demonstrate sufficiently that you are paying full attention to the patient agenda, belief, and preferences, they might give us a tick in the listening column. So make sure we are very carefully, we are listening to them properly, giving importance to the verbal and non-verbal cues. Language. So use language or explanation that are relevant and understandable to the patient. So you are supposed to use the language which you can understand, which you can which your patient can understand. Don't use medical jargons. Medical jargons might be easy for you, but it won't be easy for your patient. So don't use any medical jargon. No medical jargon or spoken too quickly for the patient to take in what you are saying. Don't go very quick. Go very slowly. I know you have got 8 minutes. You might be thinking about time, but don't worry about time. Don't worry at all about time, because patients, if you're doing well, your patients, your simulator will help you out. So make sure a good language which is understandable to the patient and no medical jargons, right? So these are the 10 feedback statements that you have to consider, that you have to understand in the exam, and make sure you are considering all these things properly, right? Thank you.